Imagine waking up every day with an overwhelming sense of fear, as if the traumatic event you experienced is happening all over again. This is the reality for millions of people around the world who suffer from post-traumatic stress disorder, or PTSD. Hi, I'm your host, and in today's video, we're diving deep into PTSD, what it is, what causes it, and how those affected can find help and support. Whether you're personally affected or know someone who is, stay tuned because this video will provide you with a comprehensive understanding of PTSD. Post-traumatic stress disorder can affect anyone who has experienced or witnessed a traumatic event. But what exactly happens to our minds and bodies in these situations? Let's uncover the science behind PTSD and how it impacts people's lives. PTSD is a mental health condition triggered by experiencing or witnessing a terrifying event. The symptoms can be debilitating and affect every aspect of a person's life. To truly understand PTSD, we need to look at its symptoms, causes, and treatments. Symptoms of PTSD symptoms are generally grouped into 4 types: intrusive memories, avoidance, negative changes in thinking and mood, and changes in physical and emotional reactions. Let's break these down. Intrusive memories. These include flashbacks, where the person relives the traumatic event as if it were happening again. They might also have distressing dreams or nightmares about the event. Intrusive memories can come without warning, triggered by something as simple as a smell, a sound, or a situation that reminds the person of the trauma. Avoidance. People with PTSD often try to avoid places, people, or activities that remind them of the traumatic event. This can lead to significant changes in their daily routines and social interactions. Avoidance might mean staying away from certain locations, avoiding conversations about the event, or even blocking out memories of the trauma entirely. As negative changes in thinking and mood. This can manifest as negative thoughts about oneself or the world, feelings of hopelessness, and emotional numbness. They might also experience difficulty maintaining close relationships, feeling detached from loved ones, and losing interest in activities they once enjoyed. This aspect of PTSD can severely affect a person's overall outlook on life and their ability to connect with others. Changes in physical and emotional reactions. Also known as arousal symptoms, these include being easily startled, feeling tense or on edge, having difficulty sleeping, and experiencing angry outbursts. These symptoms can lead to difficulties in daily functioning, making it hard to concentrate, perform at work or school, and engage in social activities. Causes of PTSD can develop after any event that causes intense fear, helplessness, or horror. Common causes include combat exposure, physical assault, accidents, natural disasters, and childhood abuse. But why do some people develop PTSD while others don't? There are several risk factors that might increase the likelihood of developing PTSD, such as a history of mental health problems, lack of a support system, the severity and proximity of the trauma, and even genetic factors. For instance, individuals with a family history of mental health issues may be more predisposed to PTSD. Similarly, those who lack a strong support network of friends and family may find it harder to cope with traumatic experiences. The brain and PTSD affects the brain in several ways. The amygdala, responsible for processing fear, becomes overactive. The prefrontal cortex, which regulates our emotions, becomes underactive. And the hippocampus, which helps process memories, can shrink in size. These changes in the brain can explain why people with PTSD experience such intense and persistent symptoms. Understanding these changes is crucial in developing effective treatments. For example, the overactivity of the amygdala leads to heightened fear responses, making sufferers more prone to anxiety and panic attacks. The underactivity of the prefrontal cortex impairs the ability to regulate emotions, leading to difficulties in managing stress and emotional reactions. The hippocampus, involved in memory formation and retrieval, may shrink due to chronic stress, affecting how traumatic memories are processed and stored. Treatment and management. Fortunately, there are effective treatments available for PTSD. These can help individuals regain control over their lives. Therapy, cognitive behavioral therapy, CBT, is often used to treat PTSD. It helps patients process their traumatic experiences and change negative thought patterns. Through CBT, individuals learn to challenge and reframe their thoughts about the trauma, which can reduce the power those memories have over their emotions and behavior. Eye movement, desensitization and reprocessing, EMDR, is another effective therapy that helps reprocess traumatic memories. During EMDR sessions, patients focus on traumatic memories while experiencing bilateral stimulation, such as side-to-side eye movements, which can help reduce the emotional impact of those memories. Medications. Antidepressants such as SSRIs can help manage symptoms of PTSD. They work by balancing chemicals in the brain that affect mood and stress. These medications can alleviate symptoms like anxiety, depression, and sleep disturbances, making it easier for individuals to engage in therapy and other treatment activities. Self-care strategies. Exercise, maintaining a healthy lifestyle, and practicing mindfulness and relaxation techniques can also be beneficial. Physical activity can reduce stress hormones and increase endorphins, improving mood and overall well-being. Mindfulness practices, such as meditation and deep breathing exercises, can help individuals stay grounded and reduce anxiety. Building a strong support network is crucial. Connecting with friends, family, and support groups can provide emotional support and reduce feelings of isolation. And living with PTSD. Living with PTSD can be challenging, but many people lead fulfilling lives with the right support and treatment. Let's hear from someone who has experienced PTSD firsthand. Survivor. Talking about my experiences and seeking professional help was life-changing. It's important to remember that you're not alone and that help is available. Finding the right therapist and treatment plan made all the difference for me. It's a journey, but with the right support, it gets better. Post-traumatic stress disorder is a serious condition, but with awareness, understanding, and the right support, those affected can lead healthy, fulfilling lives. If you or someone you know is struggling with PTSD, don't hesitate to reach out for help. Thank you for watching. If you found this video helpful, please like, share, and subscribe for more content on mental health and well-being. Remember, it's okay to seek help, and it's okay to talk about mental health.